Today on Dr. Osborne's Zone, we're diving into a supplement, one of my favorites, that's been shown to help people with thyroid problems, muscle pains and aches. It's been shown to be helpful in diabetes and heart conditions, as well as osteoporosis. Stay tuned. We're going to do a deep dive on creatine. We'll be right back. You unlock this door with the key of compassion. Beyond it is another world, a world of science, a world of common sense, a world of sanity. You're moving into a land of both empathy and ethics, of nutritional knowledge and empowerment. You've just crossed over into Dr. Osborne's Zone. Hey, welcome to Dr. Osborne's Zone. Today we're doing a deep dive on one of my favorite, creatine monohydrate. If you haven't heard of it, it's been a popular supplement in the bodybuilding world since the 70s. And so this supplement, though, does so much more than just help build and maintain lean muscle mass. As a matter of fact, if you struggle with chronic fatigue, if you have chronic pain, if you have osteoporosis, you want to pay attention to the benefits that creatine may be able to provide to you. So let's dive in. First, let's talk about what creatine is. It is a compound made by several amino acids, specifically glycine, arginine, and methionine. So your body takes these three amino acids and through several biochemical reactions forms creatine. Now, it's produced in the body predominantly by your liver and your kidneys, and also pancreas in smaller amounts. It can be made in the testes as well in men, and so but minute amounts. The vast majority of it is liver and kidney, and then it's stored in your muscles. It's a major component of how we make energy, how we make something called ATP, adenosine triphosphate. So 95% of total body creatine is stored in our skeletal muscles. The rest is in your brain, your heart, and in other tissues that have high energy demands. Now, creatine, most of you have heard of it as a supplement, and it's making its rounds right now through, through social media as something that a lot of people are talking about and recommending for a number of different reasons. Hence why I'm putting together this crash course for you, because I want you to have the solid scientific foundation and basis for whether or not you need to supplement and what creatine may be helpful for you for. So, key roles for creatine. It has several different functions. Its primary role, though, is in energy production. It helps to regenerate ATP, which is where our body gets its energy from. This is, if you've heard of that powerhouse of the cell, the mitochondria, this is where our ATP is generated, and creatine is used to make that process more efficient and long-lasting. We know that creatine fuels muscle growth. As a matter of fact, I said this is one of my favorite supplements. This is something that I personally use on a regular basis. I use about 5 grams of creatine in water every day after my workout. And this is especially important, in my opinion, for those of you who are above 40. As you get older, it's more difficult, or can become more difficult, to maintain muscle when you train and if you're exercising, and creatine can offer vast benefits for that. So, fuels muscle growth. And when I say that, ladies, don't be scared to take it. It doesn't fuel muscle growth and make you Herculean. It just helps you build nice, lean muscle. Enhances protein synthesis and cellular hydration. So it actually pulls water into the cells and makes them fuller and more hydrated. And so it also helps with faster growth. So if you are on a timeline and you're trying to build muscle quicker, it's very effective that way. But it also helps people recover. So if you're one of those, you've worked out in the past, and the muscle soreness, what they call the DOMS, the delayed onset muscle soreness, is so severe for you that you work your legs out and you can't walk for a couple of days, and you're really leery about wanting to do exercise because of that soreness, creatine aids in that recovery. There's actually antioxidant benefits that creatine provides to your muscle that helps reduce the damage and increase the healing time. We know creatine can protect the brain. This is one of the areas where we store a lot of creatine. shields against energy deficits, and as well oxidative stress. Remember, oxidative stress is one of the root causes of neurological damage in the brain and Alzheimer's and dementia and other neurological conditions. We know from research that it actually sharpens brain function. There are a number of studies showing that it improves energy for better focus, reduce fatigue. There's also research I'll show you in a moment on anxiety and other mental conditions where creatine has been found helpful in human studies. We also know it supports metabolic health by regulating blood sugar. It aids in glucose metabolism. One of the things that creatine has been shown to do, and this is actually in humans, is it improves the glucose utilization of your cells. So if we look at a cell, that's your DNA. Excuse my drawing. I'm not the greatest drawer in the world, but in the surface of your cells, in the membrane of your cells, you have these little doorways called glute doors. And so these are doors that open and allow for the glucose to come from your bloodstream. So if this is your blood vessel and this is glucose, glucose comes through this door and then it runs through several processes in your cell, and this is how we make ATP, right, as we convert that glucose into ATP eventually. But these glute doors on the surface of your cell, creatine makes those doors work better, and it makes the genetics of production of those doors more readily, and so it actually enhances glute door production to receive and to process glucose better. Okay, let's talk about some of the myths and misconceptions around creatine, because a lot of people, I've seen this a lot, my practice, and I have young men that are trying to build muscle, and they want to take creatine, but mom is super nervous about it because they've heard maybe from another doctor that creatine is dangerous and causes kidney damage. By the way, that's not true. So let's talk about some of the misconceptions around creatine, and I'll go through this list. This was actually, you can see here, this was a great article published by many experts in the Journal of the International Society of Sports Nutrition on creatine. So you can see common questions and misconceptions about creatine supplementation. What does the evidence, scientifically evidence, really show? And so they go through all these different points. I've highlighted the things that I think are important. So number one, I've heard this question so many times, but creatine is not an anabolic steroid. It's not a steroid. It's not an illegal drug. It's not a prescription drug. Creatine is a substance your body naturally makes from amino acids, which you can eat from foods as well. So it's not a steroid. Number two here, number three on the list here, creatine supplementation, when ingested at recommended dosages, does not result in kidney damage. Does not result in kidney damage and or renal dysfunction in healthy individuals. The available evidence does not support a link between creatine supplementation and hair loss. It's another one I get asked. You have to understand that steroids, testosterone, there's a lot of people confuse creatine and testosterone. I don't know why, but they do. Testosterone causes hair loss. It causes kidney damage. It causes liver damage, among other things. Testosterone, especially in those larger doses where those bodybuilders are really trying to Hulk out. But creatine doesn't do any of those things. It does not cause dehydration or muscle cramping. It is safe and potentially beneficial for children and adolescents. So if you've got a child, and I have seen this too, I've had a number of patients come to see me with muscular dystrophy and other genetic disorders of childhood affecting their muscles. And we use creatine monohydrate therapeutically in kids. So it's not dangerous for kids. If you've got a child and you're looking to increase sports or exercise performance, and you're concerned about the safety of creatine, you don't need to be if it's being appropriately dosed. What is that dosing? In a kid, it's anywhere from 2 to 5 grams a day. And creatine generally comes in a granulated white crystal powder, and you mix it with water. You can put it in a juice or a smoothie and take it directly after a workout, but very, very safe to take. no danger for kids or adolescents, no danger either for adults. Creatine supplementation does not increase your fat. It increases your lean muscle, and it increases your body's ability to make energy. So it does not increase your fat mass. Smaller daily dosages of creatine supplementation, 3 to 5 grams, or they say 0.1 grams per kilogram of body mass are effective. Therefore, a creatine loading phase is not required. We'll talk about that when we talk about creatine supplementation. We're going to dive into how to supplement with it shortly. Creatine supplementation in resistance training produces the vast majority of musculoskeletal performance benefits in older adults. I want to call something out here. You notice it says creatine supplementation and resistance training, meaning both. If you just take creatine but you don't do the resistance training, you'll still have some benefits of creatine in terms of energetic production. But when you add the two, when you combine resistance training with creatine, you get a synergism that trumps just taking creatine alone, or that trumps just resistance training by itself. It's beneficial for a variety of athletic and sporting activities, not just for weightlifting. Creatine supplementation provides a variety of benefits for females across their lifespan. As a matter of fact, it's interesting if you look at the female cycle, as estrogen goes up in the female cycle, so too does the body's production, internal production of creatine. So if this graph represents creatine and this represents estrogen, it's estrogen being an important hormone for women. It's important for growth and healing and repair, but creatine kind of follows a curve with estrogen throughout the woman's cycle. This is one of the reasons why when we see that estrogen drop, I think we see some of that energy level in females drop too. Remember, creatine, a very important source of energy generation. So other forms of creatine are not superior to creatine monohydrate. So there's every type of salesman in the world out there trying to tell you, take this creatine or that one, this micronized version, or take it with this product or with these other things. But creatine, pure creatine crystallized monohydrate is where it's at. And all the research shows that to be the case. That's what I personally take, is creatine monohydrate. I don't fall for all that other marketing stuff that's out there. Okay, let's talk about how creatine's produced in your body. Your body makes creatine too. So in your kidneys, so this diagram kind of generally represented, I'm going to call some things out here. So in your kidney, your kidneys will take the amino acid arginine, ARG, that's arginine, and the amino acid glycine, and run it through an enzyme called AGAT. This enzyme will then create a substance from those two amino acids. It'll create a substance called guanidinoacetic acid, or GAA, which is what that is right there. So in order for this enzyme to work, so this enzyme I've got highlighted here in red, this AGAT enzyme, again, it takes arginine and it takes glycine, and it runs them through a chemical reaction to generate pre-creatine substance. This enzyme is reduced, its functionality is reduced when we have vitamin E deficiency. So it's important to know, if you're trying to make your own creatine and your vitamin E is low, you won't make it as effectively. It's also, this enzyme is inhibited or reduced in people that have low protein. So what have we been seeing push a lot in the media in the last several years? We've been seeing kind of low protein diets, animal-free, plant-based, diets being pushed. Now, when you're done watching this show today, you're going to know why that's not the greatest idea in the world, and why we need to eat foods that contain creatine. We need to eat enough protein to drive this enzyme so that we can make our own creatine as well. We also know that fasting causes a reduction in this enzyme that helps us make creatine. So, I'm a fan of fasting. I think there's definitely some benefits to fasting, but I think, just like with many things, people take a good thing, push it too far, and then, what's the old saying? More is better, right? When you go to the buffet, more food is better. No, not necessarily. You push fasting too far, too long, you can have some profound impacts on your body's ability to generate creatine, which is going to affect your energy production. Now, this all happens in the kidney. So what else might affect this is somebody who has pre-existing kidney disease. So if you've got, stage 1, 2, 3, 4 kidney dysfunction, your ability to make creatine is going to be diminished. There's actually some research where doctors are wanting to put creatine in the dialysate of people who are on dialysis. So these people with kidney disease, diabetes, who are going in for dialysis, they're doctors that want to add creatine into that dialysate back into the body to help with energy production. So kidney disease can reduce your body's ability to make its own creatine. So can liver disease. Because if we look up here, this is your liver. So we've got this enzyme GAA, or guanidinoacetic acid, that then is converted in the liver. You got GAA right here, and then you have this process where there's an enzyme that helps. This enzyme, by the way, is a methyl enzyme. So if you ever heard of methylation, methylation is the process we use to convert GAA into creatine, CR. That's what creatine is, that's CR. So we take a methyl group and add it to this amino acid compound, and then now we have creatine. And so this product, because it's a methylation product, what does it require? Folate and vitamin B12. So if your folate is low or your vitamin B12 is low, it's also going to hinder your body's ability to make your own creatine. So now we've got 3 nutrients in the mix here. We've got folate, B12, vitamin E, actually 4, because we also have protein. So in order to make creatine, you need to eat enough protein to get the amino acids arginine, glycine, and then methionine. That's what that is. You need to make sure you're eating enough protein. You need to make sure you're getting enough vitamin E. You need to make sure you're getting enough folate and B12. Okay, and so if you have all those things in your liver will produce adequate quantities of creatine, and then that creatine, what did we say earlier, that about 95% of your creatine is stored in muscle tissue, and that's what this represents, is muscle. And so then once it's in your muscle, you go through there's another chemical process, this little enzyme here, CK, that stands for creatine kinase. CK for short, but it basically converts creatine into phosphocreatine, which is this substance right here. And it's the phosphocreatine that helps drive more ATP and, in essence, drive more energy. Now, a note, because I know maybe some of you have gone to the doctor and you've had some lab testing done and you've seen this term, creatinine. Creatinine is not creatine. This is typically it's a marker that doctors will measure in your urine or in your blood, and it helps to identify kidney function. It's not the same thing. Don't get confused. I get this all the time. People come to me, they bring me their creatinine tests and say, do I need to take creatine? It's not the same thing. So CK, creatine kinase, now this is another, you ever see this on a lab test? Doctors will sometimes use a creatine kinase lab test. It's a blood test to measure for a heart attack, heart damage. You can measure CK enzymes for muscle damage. You can also measure CK enzymes for brain damage. So there's what we call isoenzymes, CK isoenzymes. What are they? The isoenzymes are, there's CKMB, which is your heart. There's CKMM, which is your muscle. And then there's CKBB, which is your brain. So if you ever go to the doctor and they ran this CK test, maybe you had muscle aches, muscle pains, and they ran this CK test, that's what they're looking for. They're looking for elevations in this enzyme because it could be an indicator that you have damage to those 3 tissues. But CK by itself is the enzyme that includes all of these, the creatine kinase from your heart, from your muscle, from your brain. So you can ask your doctor to do an isoenzyme test, which breaks those three down so that you could know. So if your CK is high, maybe most of your CK is high because it's your muscle damage, or maybe it's coming from your brain. So you can isolate where the damage is coming from if you ask your doctor to run the isoenzymes. That's just a little side note on lab. So again, it's this CK, this creatine kinase enzyme that converts creatine into phosphocreatine, which is how we then subsequently get energy. Now, on another side note, there's something we've been talking about this, all year so far, which is mold. Mold, especially fumonisin and aflatoxin. These are mold toxins, sometimes referred to as mycotoxins. But these mold toxins, when we know from animal studies that these mold toxins will inhibit the function of the enzyme creatine kinase. This is one of the reasons why exposure to mold can cause fatigue, because when you block CK, when you block creatine kinase, you don't make as much energy. One of the side effects of that is definitely fatigue. So a lot of mold patients have a chronic fatigue diagnosis. They've been diagnosed with either chronic fatigue syndrome or something like ME, myalgic encephalitis, which is inflammation of the brain. Again, creatine kinase is rich in muscle, liver, and brain tissue. We'll also see mold toxins cause liver damage. And again, one of the reasons, one of the mechanisms of action is that it inhibits this enzyme, the CK enzyme, which is responsible for helping our bodies produce energy. And when your body can't make energy, things start to deteriorate and break down. So just an aside for those of you struggling with mold, helping you understand that mold connection a little bit better. Okay, so let's talk now about some of the benefits of creatine. We've got number one benefit is muscle health. The increase of lean muscle mass, strength, and power, particularly beneficial for older adults to counteract sarcopenia. What is sarcopenia? It's age-related loss of muscle. So, we all hear the doctors tell you, oh, you're just getting older, you got to accept it. Not really. You don't have to accept it. Working out, supplementing with something like creatine will help preserve your muscle even as you age. We know that creatine can benefit us through cognitive function. It improves memory, attention, and reasoning, especially under sleep-deprived or stressful situations. And I'll show you some of the research on that in a moment. We know it offers neurological protection, shows promise in protecting against traumatic brain injuries. This is an area of science that if you've had a concussion, you ever hit your head really, really hard, or had a traumatic brain injury, the two things I recommend everyone with traumatic brain injury do as close to the injury as possible is, number one, is get creatine in you. And then number two is get omega-3, high doses, 6 to 8 or more grams per day of omega, and then here 20 grams a day, as close to that injury as possible. There's research showing tremendous benefit there. So again, traumatic brain injury and spinal cord injuries. One of the effects is it reduces oxidative damage, it reduces inflammation, and I'll show you that mechanism here shortly. Bone health. We know it supports healthy bone mineral density by stimulating bone cell activity. Cardiometabolic health, improves glucose tolerance and may lower risk factors for metabolic syndrome. I just showed you a moment ago how creatine helps upregulate the production of the doorway on your cells that allows glucose to come in and make energy. We know it's important for exercise recovery, reduces muscle damage, soreness, and inflammation post-exercise, but also aids in your recovery. So a lot of potential benefit there for creatine. Let's talk about some mechanisms. So blow this up. This is a diagram published in the journal Nutrients on the mitochondria functions with creatine and without creatine under damage. So if you look here, you'll see injury, contusion, or infarction. In essence, trauma, right? Trauma to the cells. And so what happens when you have an injury, contusion, infarction is you get changes in the cell, in the mitochondria. These changes here are represented by these red circles. So you get increased glutamate neurotoxicity. Glutamate floods into that tissue and can create a neurotoxicity effect. We get lowered ATP, that's energy. When the cell makes less energy, it doesn't heal as well. It's not as efficient in healing and repair. We get reduced oxidative respiration. What does that mean? Oxidative respiration is the process by which we make energy. So again, reduced energy. We also get an increased production of this chemical called lactate. This is where some of that pain comes from the injury, is that lactate, lactic acid buildup. We also get increases in ROS. That stands for reactive oxygen. These are free radicals. You've heard that term before. Maybe just didn't know exactly what it meant, but ROS is free radical. That leads to oxidative stress. That leads to cell damage. That leads to pain as well. And this is, again, this is the inflammation right here. So this is injury, contusion, infarction. Now, this is a normal cell with no extra creatine. This is a cell with creatine. And so you can see the green lines showing the impact or the effect of creatine. So you have the same damage that occurs here, but now with creatine, it preserves the influx of glutamate causing neurotoxicity. So it reduces that from happening. We know that creatine increases the cellular energy production. We know it reduces the formation of free radicals. We know that it reduces the lactate production, which is what caused that pain. And so it also reduces the quantity of cell damage that occurs. So we have inflammation. We still have inflammation because there's injury, but we have less of it, and we have faster recovery. And so that's one of the mechanisms of how creatine impacts your mitochondria, because this is your mitochondria that we're talking about here, and in cellular damage. So a couple of research studies down here where this diagram is based from. And so you can see here, these are human studies on traumatic brain injury. Let's blow that up so you can see it a little bit better. So what do you have? You got 0.4 grams of creatine per kilogram per day for 6 months in these patients. So that's a pretty strong, pretty high dose. And you see improved their outcomes, improved self-care, improved cognition, improved behavior functions, and communication. These are in traumatic brain injury patients. Another study done by the same group on traumatic brain injury, same dose, 0.4 grams per kilogram per day for 6 months, reduced fatigue, reduced headache, and reduced dizziness. So if you've got traumatic brain injury, this is a potential for you. Talk to your doctor about high doses of creatine. That dose structure, again, is 0.4 grams per kilogram. I know that's not in pounds. A lot of you harp on me and ask me about pounds. You could do a simple calculator, but 1 kilogram equals 2.2 pounds. So that's how you do the math, and you could take 2.2, if you take your weight, and you can determine what it is in pounds from kilograms or vice versa, and then, you can multiply that number, that 0.4 grams into kilograms. So if you're taking your weight in pounds, divide it by 2.2, your weight in pounds, if you're in the US, and you divide it by 2.2, that gives you kilograms, and then you multiply that number by 0.4, and that gives you the total quantity of creatine that you can take on a daily basis if you're in that type of a situation. Okay, let's talk about some of the other manifestations or benefits of creatine. So beyond the muscles, the untapped potential of creatine. This was published in the International Immunopharmacology Journal. And so you see here, because there's a significant pool of creatine in the brain, the utility of creatine supplementation has been examined in vitro as well as in vivo in both animal models of neurological disorders and in humans. While the data are preliminary, there's evidence to suggest that individuals with certain neurological conditions may benefit from exogenous, that means taking creatine, right? Not what you produce internally, that would be endogenous, this is exogenous. So from creatine supplementation, if treatment protocols can be optimized, a small number of studies that we have examined the impact of creatine on the immune system have shown an alteration in soluble mediator production and the expression of molecules involved in recognizing infections, especially TLR, toll-like receptors. Future investigations are necessary. So they kind of give you a visual diagram here of the benefit of creatine. So creatine helps by protecting nerves, neuroprotection. How does it do that? It reduces ROS. What did we say that was? That's free radicals. So it reduces free radicals, it increases ATP, and it increases the phosphocreatine pool. So remember, the phosphocreatine is what we want. That's the driver of energy. We know in the immune response, it downregulates what are called TLRs. TLR stands for toll-like receptor. These are receptors that will stimulate inflammation. So we know creatine helps to modulate that response down. So we get a reduced inflammation response. So it modulates the immune system from overreacting or over-responding. We also know there's benefits of creatine in the lung. And so there are a number of things that it helps to do. And so you can see here on the left, this diagram, airway hyperresponsiveness, smooth muscle thickness, elastic fibers increasing in collagen and eosinophils, interleukins 4 and 5. We know that over here, if you look here, it reduces ICAM-1 and E-selectin. These are, ICAM is intracellular adhesion molecules. These are basically, it's just a fancy way of saying these are white blood cell products that come in and drive inflammation. And so creatine can help with that inflammation. So reducing inflammation in the immune system, in the nervous system, and in the lungs. We also know that there's a mechanism of creatine and leaky gut. So you can see here that is a junction, a tight junction, if you will. These are the proteins that hold our gut cells together. When those proteins are dismantled, we get leakiness. And so then the poop and the ingredients in the poop can leak across your gut barrier into your bloodstream, creating mass systemic inflammatory responses. So we don't want that to happen, obviously. So what happens here is we know that creatine, if you look here, these are these proteins that seal the gut lining, but you have creatine kinase, that enzyme I was talking about earlier, is connected to that web of actomyosin, which is the protein that holds those tight junctions together. And so if you have increased level of phosphocreatine, you can generate more energy in the gut cells to stabilize and hold those gut cells together. Remember, those gut cells require energy to form tight junctions to prevent leakiness of gut cells. So this is one of the mechanisms of how creatine can actually be beneficial for many people, even with leaky gut. So you see cytosolic CK, that's cellular creatine kinase, that's that enzyme there, localizes to apical adherens junctions. What does that mean? Is it basically as it attaches to this protein here, okay, in complex with the cytoskeletal network, providing a conduit for rapid ATP generation. That just basically means for rapid energy production. Okay, and so it helps the cell maintain its architecture and prevents it from leaking. So creatine and leaky gut. All right, there's another component I want to talk about here, and that is in the face of cancer and other metabolic diseases where there's something called the Warburg effect. I don't want to get too technical, but so I'm going to try to make this make sense. So when our bodies make energy, there's two mechanisms or two pathways whereby we can convert glucose into energy. One of those mechanisms is called oxidative phosphorylation. You've heard me talk about this a number of times, but this is when we have plenty of oxygen. This red circle here, that's oxygen. Because when we have plenty of oxygen, we use a process called oxidative phosphorylation to generate a whole lot of energy from sugar, from glucose. About 36 ATP are generated on this equation. Now, if we don't have enough oxygen, that's called anaerobic glycolysis. Now, whereas this over here is called aerobic. So if you've ever heard the term aerobics, and you go into gym class, you talk about aerobics, that just basically means you're doing exercise where you don't run out of oxygen. You constantly have a supply of oxygen, so you can make energy efficiently. You can get energy made efficiently when you have the presence of oxygen. So if you're doing aerobic exercise, the oxygen generally doesn't run out. But when you're doing anaerobic exercise, so this would be like jogging or stair climbing or something, classic aerobic activity, jumping up and down, moving about, whereas anaerobic is typically weightlifting. So this is like weight-bearing types of exercise. If you ever lifted weights and you felt that burn in your muscle, that burning is happening because you're making this chemical right here, this lactic acid, this lactate, because you don't have enough oxygen. So this is a much less efficient way to make energy. But when we don't have enough oxygen, it's what we do. And so you can see we only make 2 ATP in this process of anaerobic. Now, the benefit of creatine is that creatine supplementation helps us to make more ATP than that too. So we get more out of our production if we have adequate creatine saturation of our muscles, and that allows us to lift more weight or to lift weight longer. And this is why creatine has a muscle growth effect. In part, it is because it improves our energy capacity, so we don't get the burning in our muscle quite as quickly. So again, this is anaerobic metabolism. So you've got aerobic metabolism, or what's known as oxidative phosphorylation, plenty of oxygen, makes lots of ATP. Then you have anaerobic, not enough oxygen, only 2 ATP are produced here, but creatine can enhance that. And then you have something called the Warburg effect, and the Warburg effect occurs when you have plenty of oxygen. You see you got the O here, that's oxygen. There's still plenty of oxygen, but the process of making energy is still producing lactic acid, which is causing an increased acidity in the cell, and it's less energy efficient. You get more than 2, but you only get 4. And this Warburg effect was initially identified by a Dr. Warburg in cancer cells. So this is one of the mechanisms of cancer cells. And so what the Warburg effect is what we're using glucose and we're fermenting glucose. So it's a different way to make the energy. Fermentation, when we ferment carbohydrates, a byproduct of that is also alcohol. But in this case, it's, you're fermenting the carbohydrate, even though there's plenty of oxygen. These are cancer cells. That's why when alternative doctors are treating cancer, what do they recommend? They recommend not eating sugar, like glucose, right? They recommend more kind of a ketogenic or a high-fat, high-protein diet. Why? Because we're trying to make energy there's a whole other way we make energy called beta oxidation. I know I'm going way too deep into biochemistry for you, probably a lot of you. But we can break down fat. We break down fat through a process called beta oxidation, and it doesn't have any of these consequences. It's a whole different mechanism of energy production. But this is why with cancer, they want you eating fat as your main source of energy so that you're not creating this lactic acid buildup in the cell, creating increased acidity. So all that to say this, creatine helps to reduce the acidic nature inside of cells, both cancer cells and in tissues going through anaerobic metabolism to generate energy. So it's another potential benefit for creatine to enhance energy production in the body to overcome potential pathology. Okay, now let's talk about some of the additional benefits and research associated with use of creatine. So I said earlier that creatine helps with maintaining the gut barrier through its energy production. And this is a study here. You can see control of creatine metabolism as an endogenous mechanism of barrier regulation in colitis, so inflammation of the colon. Dietary creatine supplementation profoundly attenuates the pathogenic course of mucosal inflammation in mouse colitis. So this is a mouse model, so mouse inflammation of the large intestine. Moreover, we demonstrate altered expression of mitochondrial and cytosolic CK. We keep seeing CK, that's that creatine kinase enzyme, in enzymes in IBD patient tissue. So when they look at actual people, at patients, they see this altered expression of creatine kinase. They're not expressing it as well. These findings highlight the fundamental contribution of creatine metabolism to intestinal mucosal function, homeostasis, and disease resolution. Now that's mechanism. So now let's talk about some of the actual that we see here. So this also has to do with inflammatory bowel disease. So you can see dietary creatine as a possible novel treatment for Crohn's ileitis. Creatine, a commonly used supplement, plays an important role in maintaining gut barrier function. That's what I just showed you. Given that dysregulation of the intestinal barrier is a hallmark of inflammatory bowel disease, it's plausible that creatine supplementation may attenuate disease severity. So these authors went on to publish a case study. Ours is the first reported case of a patient with inflammatory bowel disease who experienced significant improvement with creatine supplementation. So if you've got Crohn's or ulcerative colitis or even celiac disease where you're reacting to gluten, according to these guys, creatine supplementation might be very helpful. At least it was in this case. So importantly, we have documented worsening symptoms and mucosal ulceration, inflammation when creatine was stopped. So they had the patient on creatine, got better. They stopped the creatine, the patient got worse. And then they followed that up with starting the creatine again, and so followed by improvement in both parameters with the reinstitution of creatine monotherapy. So a good case study on a good outcome in an actual human. Not so, I know I showed you a mouse study a moment ago. And then we got another one here. This was a paper recently published in Nutrition based on theoretical considerations, experimental data with cells in vitro, animal studies in vivo, as well as pilot study with a colitis patient. A consolidated hypothesis can be put forward stating that oral supplementation with creatine monohydrate, a pleiotropic cellular energy precursor, is likely to be effective in inducing a favorable response and a remission in patients with inflammatory disease like ulcerative colitis and Crohn's. So what's the takeaway there for you? If you are sitting there and you have inflammatory bowel disease and you're on multiple drugs and you're not getting better and you're struggling, the takeaway there is maybe it might be a good idea to try some creatine. You don't have anything to lose because there's no harm in taking it, but if it's helpful, you have everything to gain potentially and win. All right, let's talk about some additional benefits of creatine. Here's another study. This is a randomized, double-blind, placebo-controlled trial in postmenopausal women with osteoarthritis of the knee. And what they did in these women is they gave these women 20 grams per day of creatine for 1 week. That's when you take high doses for a week, that's called a loading dose. And that's just to saturate your tissue quickly. After the loading dose, they dropped it. After 7 days of 20 grams a day, they went down to 5 grams a day thereafter. And so they had the treatment group, and then they had a placebo group. Now, what were the conclusions? Creatine supplementation improves physical function, lower limb lean mass, and quality of life in postmenopausal women with knee osteoarthritis undergoing strengthening exercises. So, tremendous improvements. We'll take it. That's human research. So, if you've got, ladies, if you've got osteoarthritis in your knees, you're trying to get back to exercise, creatine's a good add to your program. You can see here another study. This was a 30-patient study. These patients had fibromyalgia. They were on creatine for 8 weeks. and they witnessed a significant improvement in parameters reflecting severity of fibromyalgia to include quality of life, sleep, disability, and pain. These results deteriorated 4 weeks after stopping creatine. So fibromyalgic patients taking creatine felt better. Discontinuing creatine about 4 weeks after that creatine that was saturated in their tissues kind of depleted, their symptoms started to get worse again. They started to digress. So fibromyalgia, there's potential human benefit there, human trials on the benefit in fibromyalgia. Anti-inflammatory and anti-catabolic effects of creatine. This is a review. Well established that creatine supplementation has favorable effects on muscle and bone, but accumulating evidence across a variety of research populations indicates that creatine supplementation has the ability to provide anti-inflammatory and anti-catabolic effects. It means it reduces inflammation and it reduces the breakdown of your muscles. These findings may have application for athletes, exercising individuals, as well as disease state populations characterized by elevated inflammation. Look, if you've got a disease that ends in itis, that's inflammation. Itis is inflammation, but even diabetes is inflammation. Heart disease is inflammation. High blood pressure is inflammation. Dementia is inflammatory. All these chronic conditions are inflammatory, so that's a pretty bold statement. Disease state populations characterized by elevated inflammation, as well as older adults prone to muscle and bone loss. So if you've got osteoporosis, if you've got muscle loss, if you're getting weaker as you're getting older and struggling walking up the stairs or struggling doing as much physical activity, creatine should be on the top of your thoughts as far as a benefit of a supplement. A lot of people, gravitate toward vitamins or minerals and don't think about creatine because the creatine is largely thought to be, again, a bodybuilder supplement. So it's not something that, typically the doctors are, treating diabetes are saying, hey, go take some creatine, but should be on your radar. Here's an interesting report. This was published in Pain Medicine in 2012 of a patient with a thyroidectomy. So the patient had their thyroid removed and they were on thyroxine. And so one of the side effects of thyroxine, especially if you've had your thyroid removed, and a lot of people don't know this, but thyroxine as a medication, this is Synthroid is a form of medical thyroxine. It's a prescription drug. But thyroxine, especially if overdosed, if you're taking too much, we know can lead to pain. We know it can lead to anxiety. We know it can cause trouble sleeping, hair loss, thinning skin, increased heart pressure, palpitations, a lot of things. But key thing here that I want to stay focused on is pain. I want to add one more, though. I can't resist. There's a new study that just came out. Even if you're taking the proper dose of Synthroid or thyroxine, it contributes to bone loss. So those of you that have hypothyroidism, whether it's Hashimoto's or just classic hypothyroid, your medicine is driving bone loss. And this may be an implication here for you, if you're watching this show, to think about taking creatine and working out to try to offset some of that drug-induced bone loss. But again, in this case, no thyroid, taking thyroid medicine. The medicine is contributing to pain. And you can see here, hypothyroid case where the muscular side effects following thyroxine replacement therapy manifested as muscle pain. Long-term protection against thyroxine replacement therapy-induced muscle pain has been provided by low doses, 2 grams a day, of creatine monohydrate administration. So in this case, the creatine supplementation at 2 grams a day controlled the pain in the patient that had no thyroid and had to be on thyroid medication. Because if you've had your thyroid removed, it's game over in that regard. You can't not be on thyroid medication. But you certainly don't want to be punished with pain as a result of having to be on it. And so creatine would be, in that, according to those doctors, a valid way to help to control that. Okay, let's look at this one. Effective short-term creatine supplementation on markers of skeletal damage. after strenuous contractile activity, in other words, after weightlifting. What did they find? That creatine supplementation decreased plasma activities of CK. What did I say CK earlier? CK elevations in the blood are indicators of muscle damage, right? Especially CK, the isoenzyme MM. So doctors were measuring these markers in patients. So CK, LDH, which is lactate dehydrogenase. This is an enzyme elevation that can also indicate muscle damage. And ALD, another one that can mimic, or not mimic, but can emulate or be a measure of muscle damage. So we know that creatine normalized, reduced these elevations. We also know that creatine prevented the rise of GOT and GPT plasma activities, which are liver markers. And so we know it. So again, creatine had a liver and a muscle protective effect in humans. They also did the same research in rats and found something similar. So basically, creatine supplementation presented a protective effect on muscle injury induced by strenuous activity. So if you're working out and you don't like to get sore, as I mentioned before, consider taking creatine to improve your recovery and to reduce your pain. Okay, let's look at some additional research. This is just a summary of many human studies. There are over 500 creatine studies in humans. And so it would be beyond the scope of today's presentation to go through every single one of them. But I wanted to show you some of the ones in humans. These, again, are all human trials here listed where there's beneficial effect. So in this one up here, type 2 diabetes, 5 grams of creatine for 12 weeks. What did they have? They had improved glycemic control, in other words, better blood sugar by GLUT4 recruitment. Remember I was saying earlier that GLUT door on the surface of the cell? These people were making that door more effectively, more efficiently. We had another one on hypercholesterol, 4 times 5, so 20 grams of creatine for 5 days. And then after that 5-day load, they went down to 2 times per day for 51 days orally. And so a reduction of triglycerides and very low density lipoprotein. So, triglycerides, I'm not a big fan of worrying about cholesterol. If you've ever heard me talk about cholesterol, I have an entire video called The Cholesterol Myth. But triglycerides are a definite risk factor. Increased triglycerides increase the risk for cardiovascular events, heart attack, stroke, etc. So what they're finding in this study is that taking creatine lowered triglycerides and lipoprotein, which is another risk factor. Here are patients that had cardiac surgery. And you see they had 6 grams for 3 days pre-surgery, intrasurgical, and 2 days post-surgery. So reduced arrhythmic events and reduced need for medication, for the ionotropic medications like digoxin, to control the heart rate and to control the force of the pressure of the heart. They did a study on ischemic myocardial infarction, so patients that had a heart attack. And they found that with creatine, 2 grams bolus plus 4 grams an hour over 2 hours, reduced arrhythmic events. They found in dilated cardiomyopathy, plasma BNP level was correlated negatively with the myocardial phosphocreatine adenosine triphosphate. So basically it improved plasma BNP, which is a marker for risk of cardiac disease. And then a study here, this was no disease, but they gave creatine and they found a reduction of stress-related blood oxygen levels. So in these patients, they were inducing stress. And they found that creatine helped those people cope with that stress better. Same thing here, they found a reduction of mental fatigue and increased brain oxygen for those that were taking creatine. In this study, better central complex executive tasks with creatine while sleep deprived. So again, better mental capacity. In this study, random number generation, toward number, and spatial recall and long-term memory improvements using creatine. In this study on depressive disorder, they found a reduction in children depression symptom scores. This was a study done in kids, 4 grams a day of creatine for 8 weeks, so their depressive scores improved. Another study in depression, 3 to 5 grams a day for 4 weeks, and they found development of hypomania, mania in bipolar patients improved. Depression scores and anxiety scores improved global impression for these patients. they found another study, depressive episode of bipolar in type 1 and type 2, 6 grams of creatine for 6 weeks, higher remission rate of problems. In adolescents with SSRI, so adolescents taking antidepressants with SSRI, so like Paxil, Prozac, etc., what did they find? Clinical depression scores correlated inversely with brain phosphocreatine. So the better the brain phosphocreatine, the less depressed. PCR level improved with higher dose. Chronic fatigue syndrome, higher muscle creatine phosphate level and better oxidative capacity. So some more human studies to think about benefits of creatine and how you might apply it in your own life. Let's talk about food sources. We need to eat creatine. Ideally, we should eat animal proteins that contain creatine. Again, remember it's 3 amino acids, arginine, glycine, along with methionine that produce or help us to make creatine. So any animal-based proteins that contain those 3 amino acids in abundance is good. Remember what I also said. To make the creatine, you need vitamin E, you need vitamin B12, you need folate. And so that's what I was showing you earlier and why I showed you how creatine is produced in the kidney and liver. So you've got to have these 3 plus those amino acids. You get those amino acids from these foods. You can also, where do you get the vast majority of your B12? From meat. And this is, I go back, and I'm not trying to pick on any of you following a plant-based diet. I'm just wanting to educate you that if you're following a plant-based diet, you're going to probably be lower here, and you're going to probably be lower here. As a matter of fact, the studies on creatine concentration in vegetarians are very clear. The levels are much lower. And so if you're trying to reap the benefits of creatine and you're not eating enough creatine, then you may really want to consider supplementation with it. You see down here, vegetarians and vegans have lower muscle creatine stores due to limited dietary intake, making supplementation beneficial for these individuals. So if you're making a conscientious effort to eat plant-based, this is definitely something I would highly encourage you to use as a supplement. All right, let's talk about how to supplement with creatine. How do you use it? The biggest question is the dose. How much is enough? How much should I be taking? It depends on what your goals are, but as a general rule of thumb, if you're really trying to fast track results, do a loading dose. It's what's called a loading phase. And that loading phase is anywhere between it's usually 20 to 25 grams per day, divided doses. Don't take it all at once. Take it over, 3 or 4 doses over the course of a day for 5 to 7 days, so for about a week. After that, you reduce your dose to 3 to 5 grams per day thereafter. So the load is just to saturate your tissue very quickly to get quicker results. You don't have to do the load. I've seen people have success, tremendous success with creatine with not doing any load at all. And as a matter of fact, one of the things that deters some people from wanting to do the load is sometimes the load can cause nausea. Now that's typically overcome by having enough food with it. But if you're kind of tender stomach and you've had a history of being nauseous with supplements already, you might skip the load and just start down here at the 3 to 5 grams per day. And so that's what this is. Alternately, a steady dose of 3 to 5 grams daily without loading can achieve similar results if you use it over long periods of time. Again, if you're trying to use it acutely over a course of a few weeks, it's better to do the load. And there are certain cases where you want to do that load, where you want that heavy dose. As I mentioned earlier, the traumatic brain injury was one of those examples. So if you've had a concussion, you want to load as quickly near the injury as you possibly can. If you've had a major fracture or major trauma, you want to do the load. If you're going into surgery, you want to do a load. The week before your surgery, if you're trying to pre-plan for surgery to make sure you have enough creatine there in your tissues to regenerate and have ATP energy to heal and repair, get that level up. As far as timing is concerned, it can be taken at any time. But if you're talking about to maximize muscle growth, one of the best times to take it is right after your workout. So if you're doing that 3 to 5 gram a day daily dose, you go to the gym or you go exercise, take that creatine right after you've exercised. Now, it's important that you maintain good hydration. Creatine will saturate into your muscle tissue, and if you're not getting enough water in there, I've seen people complain of cramping and spasms. Even though I showed you some studies that said you shouldn't worry as much about that, I've seen that be true anecdotally in a number of patients. So it's always a good idea to have good hydration, irregardless. So good hydration when you're drinking it is in my important key. And then there's different types of creatine, but creatine monohydrate is the most researched and cost-effective form with excellent bioavailability. Where I would give you word of caution is right here. Beware of products that contain filler ingredients. Fillers like sugars, and if you're gluten sensitive, a lot of those fillers are tricky because a lot of those fillers contain gluten. So an example of that might be maltodextrin derived from corn or wheat as a filler agent. A lot of times you'll see rice powders as a filler agent, or you'll see other ingredients like natural flavors and that sometimes are derived from grain-based ingredients. And so you just have to be careful. In my opinion, if you're buying a creatine product that has a bunch of sweeteners and flavoring agents and all that, that's all garbage. Don't mess with it. Just leave it out. Get yourself a pure creatine monohydrate powder, and that should be the only ingredients on the label. At least that's my opinion. Now I want to share a little bit of anecdote with you, because I've seen in my own practice, I've used creatine therapeutically in many different types of individuals, but I think some of the people that are most benefited by the use of creatine, if I'm going to kind of put that out as a kind of a list for you. So number one, women with a history of bone loss, women with a history of muscle weakness, and history of muscle weakness just basically means they're sedentary. Women that are sedentary and have been sedentary for a while. Those individuals, these two classes of people really tend to benefit tremendously. I also see tremendous benefit, and this is, so let me scratch, because this is men and women, and people that have chronic fatigue. They've got a diagnosis of chronic fatigue. They just don't have the energy or the focus or the concentration. These individuals do extremely well on creatine to feel better. As I mentioned to you earlier, this showed you a study, but fibromyalgia is another example of a patient type that I have seen do extremely well on creatine. I've also seen people that have muscular dystrophy. So if you've got that as a diagnosis, creatine can be very, very helpful in that regard. So these are just some examples of people that I have seen in my own practice using creatine at that around that 5 grams a day dose over time, do extremely well and feel much better. So if you fall within that category, again, this may be something that you want to consider. Why? You've heard me talk a lot about test, don't guess. There's no test for creatine. You can't measure creatine effectively commercially. Doctors don't measure it. You can in more of a research type setting, but generally doctors don't measure it. You can measure the precursors to creatine. What are they? They're the amino acids and the B vitamins and vitamin E. So you could certainly measure those things, but creatine is one of those supplements that beyond deficiencies, so beyond the need of essential nutrients, creatine can just be beneficial, because when people are chronically sick, chronically inflamed, it helps your body make and access more energy. That energy is necessary for the healing and the repair process and for dealing with the excess amounts of inflammation. So creatine has a special place as a therapeutic. And so if you fall in those categories, or maybe you just fall into another inflammatory category in general, and you've never tried creatine, I would challenge any of you to use it for a couple of months just to see what kinds of benefits that you might have, because the upside to taking creatine is tremendous. The benefits are tremendous. The downside, the risks are almost non-existent. They really don't happen. I mean, if you stay within that 5 gram a day range, you're side effect wise, there's no great risk at all. So hope you enjoyed this class on creatine. If you did and you found it helpful, do me a favor, hit that thumbs up button, and make sure, if you're not already, hit that subscribe button. And if you know somebody who would benefit from this show, please share it with them. Our mission here is to help save 100 million lives. Every time you share, you're helping us reach that goal. Thanks so much, and we'll see you on Thursday at 12:30 for a live Q&A. Take care. Thanks for tuning in to the Dr. Osborne Zone. Don't forget to share, like, and subscribe for more content like this, and make sure you come back next Tuesday at 6 p.m. Central Standard Time and Thursday at noon 30 for more episodes.